Welcome to this edition of Seeking Solutions on NTA Enugu Network Center. I am Minna. Our guest today is a Senior Registrar, Pediatrics Department, Esouth Park Lane, Dr. Ndoka Ugochukwu Franklin. Many thanks for joining us on Seeking Solutions today, sir.
Thank you very much. I'm glad to be here.
Okay, let's start from the basis. What is measles?
Okay. Measles is a viral infection which is characterized by a cough, nasal discharge, high fever, and a very common rash, which everybody knows about.
Okay, so who is at the risk of contracting this measles?
Okay. Well, everybody is actually at risk of contracting measles. However, there is particular age range who are more susceptible to having this. That is, those that have never had it before, and then also the age ranges below 5 years. These are the age range that are at risk. However, the age range that are more likely to come down with serious infections or more severe infections are actually those below 1 year of age and above the 20 years of age.
Okay, so what causes measles?
So, measles is a viral infection. It is an RNA virus, belongs to the family of paramyxovirus and the genus morbillivirus. It's very common at this season we are in, and it's basically transmitted through the aerosol route. And like I said, it's commonly characterized by the cough, the catarrh, the redness of the eyes, and then the rash.
Okay, this season that we're in, are you talking about the hot season?
Well, we know that there are certain seasons that encourage the viral infections and the spread. Commonly, the dry season, it's been found viral infections are more pronounced, are on the increase during the dry season. One of the also other common illnesses that are transmitted as very common now is the acute gastroenteritis also, which is also very pronounced within the season.
So let's look at the signs and symptoms of measles. Most people just see rashes. Doesn't mean that every rash on the body is measles.
Definitely not. All rashes are not measles. The measles is starts with the fever, which can be low grade or can be very high. It's also the other symptoms which are characteristic of measles. Also, we have the redness of the eyes, which we call conjunctivitis. We also have nasal discharge, and we also have a cough. Now, the last symptom, which crowns it all, is the very unique measles rash, which we describe as maculopapular. Some of them are flat, some of them are slightly raised, and they come in clusters.
Okay, the measles, I know they are very contagious. How do people contact them?
Yes, the measles virus has the measles infection itself comes in a phase. We have the incubation phase. At this phase, when you have come in contact with the virus, you don't actually know that you have the virus itself. And then we now have the prodromal phase. At this phase, we then begin to develop symptoms like the cough, the nasal discharge, the redness of the eyes, and the fever. It is towards the late phase of this prodromal phase that you can actually spread and transmit this virus to other people. And the measles virus itself is transmitted through aerosols, through nasal droplets. I said before that there is a conjunctivitis, that is the redness of the eyes, and with that there is increased tearing. There is also nasal discharge. The nostrils will be producing a lot of fluid, and there is cough. So once you are within the phase where you can transmit the virus, if you cough, or if you the tears, the tear droplets, or the discharge from the nose comes in contact with some other person, that person can actually contract the virus and come down with measles. And it's pertinent to note that the measles virus is very light. It can actually be suspended in the air. So when somebody sneezes, for example, especially in poorly ventilated environment, the virus can actually be suspended in the air. So someone can actually inhale the virus without knowing. So it mustn't necessarily come in contact with the fluid. You can also inhale the virus from somebody that has sneezed and have the nasal droplets suspended, the virus itself suspended in the air.
Okay. You know, most people, when they begin to have a running nose, cough, catarrh, they just generally conclude that they have malaria, and they dash to the pharmacy to grab some malaria drugs. Is there anything special to discover, to let you know when you start sneezing and coughing that is the incubation period of measles, probably that could help you nip it in the bud even before it gets to the next stage?
That's the tricky thing about measles. There's no within that prodromal phase, you may not know that this is measles except when the rash begins to manifest. A lot of conditions, viral infections, and even bacterial infections can manifest as cough, catarrh, nasal discharge, redness of the eyes, and even fever. However, measles crowns it all with the unique rash that it comes subsequently.
Okay, so let's look at the preventive measures. You said here earlier that measles can be prevented. What measures can we take to ensure the prevention of measles?
Now, prevention of measles generally, we talk about the general health promotion, where it's encouraged that you should have good nutrition. It's important to note that it's not everybody that comes in contact with the measles virus comes down with the illness proper. So good nutrition is very important. So your body can actually have immunity to be able to fight the infection when you come down with the measles itself. So your body can be able to mount an immune response. You can also, there are other specific preventive measures where the immunization, the vaccination that we administer at the 9th month of life, which is very, very important in the prevention of the measles itself. Other preventive measures are when you now come down with the illness, what to do when you come down with the illness proper.
Okay, how do you diagnose measles?
Measles virus, it's actually difficult to diagnose in the laboratory. However, we rely more on clinical diagnosis. I mentioned that we have the incubation period. You don't have any symptoms within that period. Then the prodromal phase, we have the cough, the catarrh, nasal discharge, redness of the eyes. So when these symptoms come up, and then you present to your health practitioner, he can have the high index of suspicion and expect that this may be the measles that is actually in the prodromal phase. However, when the rashes itself begins to manifest, the rashes are unique in this morphology, in this appearance. I describe it as maculopapular. Some of them are flat, some of them are slightly raised, and then they begin to appear more from the hairline or behind the ear, and then come down towards the midline and then the extremities of the limbs. So measles rashes starts from the face, behind the ear, the hairline, and then comes down, unlike some other disease conditions that also come with rashes, where they can't start from anywhere and then end up anywhere. But measles rashes are very unique. Start from the face and then come down to the midline. Then this clinical presentation helps us to be able to make that diagnosis of measles. However, there are other laboratory diagnoses that can be made, even though it's not very commonly done in this environment. We have the IgM, the immunoglobulin M, which can unique to measles. You can also have a rise in titer of immunoglobulin G, and then the virus itself can actually be cultured in the lab. But like I said, it's not commonly done here. We rely on clinical diagnosis to make rely on clinical presentation to make diagnosis of measles.
Are there some other medical conditions that may present themselves just like the other symptoms of measles?
Yes. Other viruses, there are many viruses. Other viruses can present similarly with cough, catarrh, even redness of the eyes, and even rash. But the unique nature of the rash in measles is not shared with any other viral infection There are also other conditions like drug reaction. So someone can have be taking a drug and have a drug reaction manifesting with these rashes, generalized body rash, but not unique to the measles rash. And then also the person may not have the other symptoms like the cough, the catarrh, redness of the eyes, and then the high fever associated with measles virus.
Okay, we're still here discussing measles, the treatment, prevention, and management with Dr. Nduka, very much still in the house. We'll take a short break, after which we'll be right back. Stay with us. Welcome back. It's still Seeking Solutions on NTA Enugu Network Center. We're here discussing measles, the signs, symptoms, prevention, treatment with Dr. Nduka in the house. Okay, doctor, maybe we should look at some of the preventive vaccines available for measles.
The measles vaccine, it's administered when the child is 9 months, and it's administered once, and it's a live attenuated vaccine, meaning that it's actually a live measles virus which has been attenuated, it's been made powerless, so that when it is administered to the child can actually be able to surmount the overpowered measles virus and then mount an immunity, so that whenever the person now comes in contact with a measles virus from any other person that comes out with that has measles, the person may be able to mount a good immune response and overcome the measles. However, it does not totally prevent one from coming down with measles. However, it gives you the ability to prevent you from coming down with severe forms of measles. That's what the measles vaccine does.
Okay, so in other words, you're saying that being vaccinated with the measles vaccine does not even secure you, stop you from coming down with measles.
Exactly, it doesn't stop you from having measles. However, it gives you an edge, in which case you can mount a good immune response when you become exposed to the measles virus and not come down with the severe forms of the illness.
The vaccines, are they taken just once in a lifetime?
Yes, it's given at when the child is 9 months. However, different countries have different vaccine schedules. However, that for Nigeria, according to the National Program on Immunization, administers measles vaccine only at the ninth month of life.
Okay, I do see some pregnant women that come down with measles. How come, and what's the danger given their condition?
Measles in pregnancy is a very dangerous situation, and it comes with a lot of complications both to the mother and the child. It can lead to both the death of the mother or the child, and it can also lead to spontaneous abortions or congenital malformations. So any mother that is diagnosed with measles is actually a very serious situation and needs to be managed very closely by her physician.
Wow, that's serious. Okay, now how can these measles be managed?
Measles, as with other viral infections, is managed conservatively, based on the symptoms that the patient presents with. As I've mentioned, the patient comes with fever, high fever, in which case we give antipyretics like paracetamol, or we also educate the mother or the caregiver to expose the child whenever the child has fever at tepid sponge with what we call tepid water that is lukewarm, the same water that you can use to bathe the child that is not hot or not cold. So you can use that to tepid sponge the child so you can control the fever. Then also when the child they can come with cough, they can come with the conjunctivitis, they can come with the nasal discharge. We can give antitussives which can help with the cough, and then also because of the pathophysiology or pathogenesis, how measles comes on, it exposes the person to other bacterial infections. So during the course of the illness, there may be need to put the person on antibiotics. Then there are also other drugs that the patient may benefit from. Most importantly is the vitamin A, which also, because of the way measles occurs, it tends to destroy the epithelium of the respiratory pathway. So vitamin A is very essential because it helps in the regrowth of all those epithelium and also in the regrowth of the antibodies that are responsible for fighting off the measles virus itself.
Is it necessary to quarantine patients of measles?
Well, yes, it's necessary to, make them not to come in contact with the general population, or especially because of the age range that are most likely that are at risk of contracting the virus itself. School children or preschool children or even toddlers, whenever they come down with the virus, the disease itself, it's best to keep them, avoid them making contact with other children, because adults have the immunity already, or may have already had the measles infection itself, and will not come down with the illness again. So they can actually come in contact with the child. However, it's advisable to prevent the child with measles itself to not to come in contact with others, and then also make sure the room is well ventilated, because spread through aerosols. When the child sneezes or coughs, there will be an avenue for the virus to be dispersed into in the air outside the room where the child inhabits.
Are there some more complications that could arise as a result of measles?
Yes, there are more serious complications that can arise from measles. One of the commonest is otitis media. That is an infection of the middle ear. Like I mentioned before, the pathogenesis of measles, it tends to affect the epithelium, that is the surface, the skin of the linings of the respiratory tract, and then the other epithelia. So it can cause otitis media, which is an infection of the middle ear. It can also cause the child to have a pneumonia, which is an infection of the lungs. Then it can also cause other complications like croup, which is laryngotracheal bronchitis. It can also cause the child to have tracheitis. It can also cause the child to have diarrheal illness. These are all possible complications. There are other more severe complications of measles. That is why it's always advised that whenever you have the suspicion of measles, you always do well to present to your doctor, so that appropriate measures to be instituted to prevent the child coming down with these complications.
Are there some home remedies for treatment of measles? Because I do see some people, when they have the rashes, you see that they always rub this whitish whatever,
Okay. Yes. The child that has measles, like I said, will have fever. You can tepid sponge, wipe the body down with tepid water to prevent the fever from going up, because very high fever can cause the child to have a convulsion, condition we call a febrile convulsion. So keeping the body cool is one of the home remedies one can do. Then also making sure the child is well hydrated is also one of the measures that can also prevent the child, reduce the severity of the illness, making sure the child takes a lot of water. Then the whitish material, which you quite rightly noted, what we call calamine lotion, is what it does basically is to keep the body cool, because the measles rash itself can be itchy and uncomfortable to the child. When you apply the calamine lotion, it keeps the body cool and reduces the itchy sensation that the child can come down with. All the other management involved based on what the doctor sees and then tells you to institute, both either at home or in the hospital on admission.
Okay, let's now generally look at the treatment of measles.
When you have a child, when your child begins to manifest symptoms of fever, catarrh, cough, redness of the eyes, it's best to present to your medical practitioner. At this stage, the doctor himself will have other disease conditions, and even measles, as a provisional diagnosis. He will administer antipyretics, that is, drugs that will control the fever. He will also give you antitussives, cough syrups to relieve the cough. And then when the child now begins to manifest the rashes proper, the doctor can either use the calamine lotion, which I told you basically keeps the body cool, or it can also give you other drugs that will also help with the itchy sensation that the person can come down with. Then the vitamin A, which I told you is very important in patients that have measles, is for those that are less than 6 months. Is giving 50,000 international units on the first day and the second day. And for those that are above 6 months, you give 100,000 international units, still first day and second day. And above that, those that are above 1 year, give 200,000 international units. Then other symptoms, other management procedures depends on the complications the person can come down with. Those that come down with otitis media will need to be on antibiotics. Those that come down with a bronchopneumonia may need to be admitted, oxygen therapy, fluid therapy, either child taking in a lot through the mouth or as an intravenous or parenteral route. Then also those that have those that have diarrhea, that is frequent stooling as a complication, we also need other fluid therapy, and then also other treatment measures like the zinc gluconate that we give and other measures.
Okay, Doc, before I let you go, I need your general advice to parents as per at what point they will need to bring their children to the hospital once they notice anything that looks like measles.
Generally, it's advisable that when you have a child or a ward, or even you yourself, you have symptoms, you are not feeling fine on the first day. So, for example, you have fever on the first day, you give yourself an antipyretic or drugs that will control the fever, and then the second day the symptoms still persist. It's advisable to present to the nearest hospital for proper evaluation. Self-medication is never advisable. If you present early, the complications of measles are more likely more likely will not occur. So early presentation is very important to prevent, avoid these complications from occurring, because when these complications come up, they will now, cause the management, complicate the management, and either result in you being on admission or result in longer duration of illness.
Okay. Dr. Nduka, I want to thank you so much for your time on Seeking Solutions today. We appreciate all that you have said here today.
Thank you very much.
Thank you. As you have heard, measles is not a death sentence. It can be prevented, treated, and managed. Valuable piece of information that will surely help us all out as we battle measles. And that's a wrap on Seeking Solutions today. Thank you for your time. See you around next week. Happy weekend.
Spreading of false and misleading information is capable of threatening the peace and security of the country.